Right, I think we can get started. So welcome everyone. My name is Meli Cambonza and I am the VP of Development for Alzheimer's Los Angeles. Thank you so much for joining our virtual speaker series. Just a reminder to please mute yourselves. And if you do have any questions, like I mentioned, please type them into the chat feature and we will try our hardest to answer all of those questions. And we've allocated about 10 minutes or so at the end to answer any of those questions. So I just wanted to, again, welcome you all to Alzheimer's Los Angeles. The mission of our organization is improving the lives of local families affected by Alzheimer's and dementia by increasing awareness, delivering effective programs and services, providing compassionate support, and advocating for quality and a cure. I'm very proud to be a part of this organization and part of a team that has seamlessly pivoted to providing online and virtual services for all of our clients. We are so excited to launch this free summer speaker series to our community. This is the first time we've done something like this, so our hope is that we can be a resource to you and to our community. After our speakers finish towards the end, we'll also share our contact information at the end of the session, so you can visit all the wonderful resources we have on our website. Like I mentioned, we will also be recording these topics and they will be available afterwards. Today's topic is about inequities in our healthcare system and how it's affecting people with Alzheimer's and other forms of dementia. Today, we are going to have an intimate conversation from some of the wonderful staff leaders at Alzheimer's Los Angeles. Thank you, Albert. Next slide, please. Next slide, please. Thank you. And just one more, Albert. Thank you so much. So I wanted to spend a couple of minutes introducing our wonderful speakers for today. First, I'd like to introduce Jennifer Schlesinger. Jennifer is the Associate Vice President of Healthcare Services and Community Education at Alzheimer's Los Angeles. Jennifer oversees multiple nationally recognized and award-winning projects, including those focused on transforming healthcare in the state of California for low-income older adults with dementia. Jennifer provides technical assistance and training to healthcare organizations to improve their care management for people living with dementia and their families. She also oversees caregiver education program and teaches plain language approaches. Next, I'd like to introduce Petra Niles. Petra is a gerontologist and current senior manager of African American Services, Education and Dementia Care Network at Alzheimer's Los Angeles. She has been working with the organization for over 10 years and has extensive background in aging issues and the larger community. Petra provides ongoing education and outreach in the Los Angeles area, as well as implementing culturally specific workshops to the African American community in collaboration with faith-based institutions and others. Many of her efforts are focused on improving services to persons with dementia, their families, and caregivers, particularly in the West Central, South Central Dementia Care Networks, which she coordinates. Next, I'd like to introduce Alicia Villegas. Alicia is the Director of Early Stage Services and Latino Services at Alzheimer's Los Angeles. Alicia has been with Alzheimer's LA for 9 years. As Director of Early Stage Services, Alicia works directly with people who are in the early stages of dementia and their care partners, helping families navigate through difficult decisions and uncertainties. Alicia also oversees early stage programming. As the Director of Latino Services, Alicia provides management and oversight of Latino services, ensuring services are culturally and linguistically appropriate for Latino communities. And last but not least, Angie. Angie has been the manager of Asian and Pacific Islander services at Alzheimer's Los Angeles for the past 3.5 years. In this role, she provides education and outreaches to the diverse Asian American and Pacific Islander communities, raising awareness and connecting people impacted by Alzheimer's and dementia to appropriate services and support. Angie has a master's in Aging Service Management from the University of Southern California and is a semester away from completing her Master's of Science in Dementia and Aging Studies. Angie's family has been directly impacted by dementia, and because of this experience, she has dedicated her career to serving and advocating for older adults and families. Now, before we jump in, I just wanted to mention a few things. You know, when we were discussing the theme for this particular topic, my colleagues and I determined that an hour is not nearly enough time to talk about the health inequities that are affecting our community, and specifically people of color. We are aware that there may not be a one-size-fits-all approach or strategy, nor that one single statement can address the multiple issues we are dealing with. We'd like to have a discussion and come up with different ideas and solutions to making this health inequities better. What we have seen unfold in the last 4 months with the pandemic and events occurring around the world, I would like to mention some statements to keep in mind. We have seen inequality as well as inequity in some recent events. First, we saw the Asian community as a target for racism and xenophobia. Second, we saw that Black Lives Matter movement take stride in cities like Los Angeles and across the world. Thirdly, we have seen the disproportionate number of Latinos being tested positive for COVID-19. And finally, we have seen how age and ageism took a front row seat through this whole pandemic. With this, I would like to hand it off to our first speaker, Jennifer. Thank you, Jennifer.
Thank you all so much for this opportunity to talk about such an important topic around dementia, healthcare disparities, and inequities. What I want to do is paint some kind of broad strokes of the healthcare landscape in the United States as it relates to dementia specifically. We all know that rates of dementia are increasing in the United States, yet it is still not a well-recognized or well-managed disease. And in general, our healthcare system is what I would call not very dementia capable. It lacks in 3 primary areas. So the first is there's poor identification and diagnosis of people with cognitive issues. About 50% of people with dementia never get a diagnosis, and of those that do, only about half of those folks actually get the diagnosis documented in their medical record. This is an eye-opening statistic and statement, what I just said, because our healthcare system is structured around managing disease. And if a disease is not recognized nor diagnosed or even documented in a medical record, it's nearly impossible for the healthcare system to be responsive to the needs of that person given their cognitive issues. The second kind of bucket or issue facing our healthcare system as it relates to dementia is there's a lack of family caregiver focus and support. Our healthcare system operates in a traditional model of a provider and a patient, right? A doctor and their patient. And dementia care is really what we call dyad care. The dyad is the person with dementia and their care partner or caregiver, and then also working with a provider. Traditionally, our healthcare system doesn't identify family caregivers. They do a tremendous amount of work. They are the key to keeping a person with dementia at home. Yet the healthcare system doesn't necessarily identify who these people are. Healthcare still does not necessarily assess family caregivers for their respective needs, whether it's health needs, emotional needs, training needs. And the healthcare system may not support family caregivers, especially if the family caregiver is not a member of that particular health plan. So we have a healthcare system that does not necessarily include the family caregiver in the care and the care management that dementia care requires and necessitates. And then we have a healthcare system, or just a system in general, I would say, that has really inadequate collaboration between healthcare systems and community-based organizations. So what we see is that there are agencies that exist that could really complement each other and provide a lot of robust support around medical needs, but also around the social and psychosocial and educational needs of families. Yet we have these systems that still operate in silos. So our community-based organizations work over here and our healthcare system kind of works over here. And this creates inherent issues, especially for a disease like Alzheimer's disease or related dementia, where we know that after a diagnosis is made, the majority of dementia care is non-medical. It's around things like, how do I deal with the behavioral symptoms of the disease, the safety concerns? It's about advanced care planning. How do I improve my communication techniques? And the healthcare system is probably not as robust in that area of expertise, but community-based organizations, and specifically Alzheimer's organizations, that is where the expertise exists. You know, we at ALZLA, we've been working with healthcare systems to improve their dementia capability, but change is such a slow process, especially when you're trying to move a system of care. And we've been impactful and have seen systems of care change to be more responsive to the needs of families affected by dementia, but there is certainly a long, long way to go. You know, the current COVID-19 crisis presents new and unique challenges for individuals with Alzheimer's disease and related dementias. And really, COVID-19 puts a magnifying glass on existing gaps in healthcare, on inequities, and on disparities. These gaps in our healthcare system have existed for a very long time. Inequities in healthcare, disparities in care, access to care have existed, but we can almost look at COVID-19 as the great amplifier of these things. It's the lens that we can superimpose on these existing gaps and inequities, and we really see even more clearly where some of these deficiencies have been. Alzheimer's and COVID-19, interestingly, sadly, have what I'll call kind of parallel risk factors that are particularly pronounced for people who are elderly and for people who are lower income. So these risk factors are not necessarily associated, but they're running parallel to each other. First, people over 65 are at increased risk for Alzheimer's disease and for COVID-19. Age is the single greatest risk factor for Alzheimer's disease. And older age often results in worse COVID-19 outcomes. And we know that deaths from COVID increase with age as well. Current statistics, we know that the statistics on COVID-19 are changing every single, I was going to say day, but sometimes hourly, you see some startling new statistics come in. But about 80% of COVID-19 deaths in the United States are people over the age of 65. A second parallel risk factor is people with Alzheimer's often have multiple coexisting conditions, talking about things like hypertension, diabetes, heart disease. In fact, the average person with Alzheimer's disease has somewhere between 2 and 8 coexisting chronic health conditions, which makes managing care extremely complex. And when I go out and train healthcare professionals, I will say it's not business as usual. When someone has dementia, we need a dementia-informed lens to guide the way that we manage care because it can be so incredibly complex. These same conditions are the conditions that put people at greater risk for developing a serious illness from COVID-19. And third kind of parallel risk factor is older Hispanics and Latinos and Blacks, African Americans are 1.5 to 2 times as likely to have Alzheimer's disease or related dementia than non-Hispanic whites. Similarly, COVID-19 illness and death are disproportionately affecting racial and ethnic minority groups. When I look at the death rates that account for age and COVID-19 in LA County, and see the differences in mortality rates between racial groups, it's sickening. The health disparities and inequities in our country are simply egregious. And then if I shift and talk about COVID and nursing homes for a moment, 50% of people living in nursing homes are believed to have Alzheimer's disease or related dementia, 50%. And somewhere between, again, statistics keep changing, but somewhere between what we've been seeing 27%, and I've seen up to 50% of COVID-19 deaths occur in long-term care facilities. So somewhere between a quarter to half of our COVID-19 deaths are happening in these facilities. And there is a black hole when it comes to infection rates in facilities, testing, communication channels for residents. We really don't have our pulse on what is happening in facilities. We essentially have a situation where people are stuck and have few protections or safeguards for their health. And that's a startling statistic that merits urgent attention and action. Our team at Alzheimer's LA has been working with other organizations and both statewide and nationally to advocate for some of these protections for both workers and for residents as well. So hopefully with that, I've shared a little bit about the overall landscape, and I'm going to turn over to my colleagues who can speak about some more boots on the ground work that's being done in these specific areas.
Great, thank you so much, Jennifer, for sharing all that. Petra, if you'd like to go next.
Everyone, and thank you for joining us today. Thank you, Jennifer, for sharing that. As the Senior Manager for African American Services, the work that I do is culturally specific. However, I can only do my work with our community partners who are amazing partners, and some of you have joined us today, and I really appreciate that. Our partnerships in the community are two-way, and my work involves a number of challenges, as Jennifer mentioned, existing documented inequalities, injustices, and disparities for many, many, many years, that the gaps and the barriers around the lack of access to care, getting the proper diagnosis for African Americans have been a challenge. And for many years in my work, there have been very few people who's actually seen an African American in the early stage of the disease. And so as I am educating in the community and I discuss early stage, many people are thinking that their loved ones are in early stage, but it's actually middle and almost late. And so the lack of proper diagnosis is definitely a continuous challenge. It's also important to note that when you are working with the community who is at risk for so many issues and areas, that there has to be a sensitivity of how information is presented. It's sometimes very, very overwhelming, the idea that here is one more thing, and you're telling me what? One more thing that we have that has to be considered in a lifetime of issues and inequalities and injustices. Alzheimer's Los Angeles has been working with the African American community, Black community, for a number of years. The entire time the organization has existed, and has created the West Central, South Central Dementia Care Network, which I facilitate. And we meet quarterly to discuss and look at the areas of concern. This group consists of a number of people. It's just regular community members who are concerned about the effects of dementia in the community. It also includes nurses, RNs. It includes support group facilitators. It includes some of our wonderful primary physicians who just sometimes stop by because the areas and the discussions that we have are important to them and to their patients. It also includes some of our local legal offices, especially the the Collins Law Firm in Inglewood, and they are an amazing group that provides services in the community regarding elder law planning and dealing with any issues of legal concerns. We also, what happens in this group is also a high level of advocacy, and what that looks like varies. It could be simply making sure that other community members are aware of the group, that other community members are aware of our organization, that other community members know that I am the person that they can call and refer to if they have issues or concern, that I am potentially a person they can partner with if it's an organization or a church. And so we have that wonderful camaraderie as it relates to partnerships. The partnerships have existed for many, many years. And so recently we celebrated someone who is an LCSW, and she's 100 years old. And for a lot of her time, she has been working with the Dementia Care Network and still continues to as much as possible. As we continue to do the work, we try to identify who is not at the table and who needs to be at the table with us as we continue to make headways in some of the areas of concern that continues to kind of plague the African American community. And so it's important, as I mentioned, primary physicians, they're the ones who actually see, while they're not geriatricians or neurologists, they're critical to our work because they see many of the families who have some high level risk factors. And so areas of blood pressure issues and blood sugar, diabetes and cholesterol, these basic things, numbers that may go out of control for many, many years, but there's a primary physician who may identify and recognize that and be able to start the family on a journey of overall increased health. And so there are a number of community partners that are important and critical to our work, and we appreciate all of them who work with us, and thank you for your time.
Thank you so much, Petra, for sharing that. Alicia, if you'd like to go next.
Okay, hi everyone. I'm Alicia, thank you. Just like my colleague Petra highlighted, many I'll be speaking about Latinos and also some early stage concerns, but to start off with the Latino population, just like Petra highlighted, a lot of Latinos don't get diagnosed in the early stages, and that could be attributed to a lot of different challenges and reasons. And I could share a little bit about what I see in my work with the Latino community that I feel like impacts both Alzheimer's disease diagnosing and kind of what's going on currently with COVID-19 and kind of what I've heard and in working with the Latinos. You know, Latinos are very private and self-sacrificing and don't air their dirty laundry. And so a lot of times they will see changes in their family members and just either, you know, work on it privately, or they might go to the doctor and talk to their doctor, and you know, if the doctor says it's fine, it's a normal part of aging, they don't advocate any further and they just go home with that, and that's just what it is. Grandma is she's just growing older, and it just kind of stays hidden in the family. And it's not till challenges and behaviors become really more overwhelming for families that we see some of those folks coming to us and needing some support and education. You know, families Latino families live in these multi-generational homes where caregivers taking care of younger kids, but also older adults. And as we've seen in the news, you know, those frontline workers do tend to be Latinos and African Americans who are you know, working in factories, who are working at grocery stores, who are street vendors, who are farm workers, restaurant workers, and all of this does increase the risk of contracting COVID-19 just through exposure. And then coming home to those multi-generational homes where they live with a grandma or a grandpa or an older parent who is at higher risk of contracting COVID-19, does affect Latinos directly. There's also just a lack of understanding if we're kind of talking about, again, Alzheimer's disease. But along the same lines, what I have seen is that a lot of people don't understand the severity of COVID-19, but also can't really do a whole lot to protect themselves if they have to be out there working, if they have to be leaving their homes constantly. And in looking at where Latinos get their information, if I just turn on a Spanish news channel, a lot of what the media in Spanish highlights is celebrities and gossip and what they're talking about in terms of COVID-19. And if it's not what a celebrity member or a celebrity that these, people really look to because they see them in their homes every night on soap operas, and if it's not one of them that's being affected, it's not something that they are highlighting on TV. And so the information that Latinos have access to is sensationalized, and they will have, celebrities that talk about how they don't believe in COVID-19. And so then there's just a lot of misinformation that gets kind of spread in that way. And it's just really difficult for Latinos to access real and factual information. And I think that, because Latinos are at higher risk, like Jennifer said, 1.5 times more likely to have Alzheimer's disease, and because of all of these other concerns that they can't, really protect themselves, it just really shows how Alzheimer's disease and COVID-19 represents a huge threat that does disproportionately affect these communities. In terms of early stage folks, I have seen certain things that have been highlighted to me as challenges, as it is for early stage folks. They have these challenges or these concerns that they're faced with. Should we disclose our diagnosis? Are my friends going to stop talking with me? Are they, how do I find meaning in life? As people progress in the disease, it's so important to have a routine, to have structure. And with COVID-19 and all the changes, people obviously are confined to their homes, can't access activities out in the community, can't go to their groups that they were used to going to, can't continue with their hobbies that they were able still to do independently. And so that's a huge disruption in the life of an early stage person that they probably struggle with, because now they have to adapt to being at home, to finding activities that are engaging to them, that are meaningful to them, so that they can still find meaning in their life. But along the same lines for caregivers, not being able to find a place that is theirs to practice self-care, to manage things that they still need to manage for themselves. And I agree that COVID-19 does highlight inequities in our communities that we have always known existed. And even though we as an agency have shifted and offered a lot of our courses virtually and on the phone, a lot of our communities, like Latino communities, they still have these challenges where they don't have maybe the devices that they need to get onto our virtual courses, to join a Savvy Caregiver 3 times a month. And that's maybe because, again, they don't have an extra iPad because the kids also need to do it for school, or whatever other adult is there also needs to join a work meeting. Secure or Wi-Fi that is dependable. Is our material in Spanish and culturally appropriate? I mean, these are all things that I think we continue to work on, but it just continues to highlight that Latinos are a hard population to connect with and to provide appropriate disease education to, and for them to kind of help trust us as an agency that this is the information that we're able to appropriately provide to them. And I don't know that there's possible solutions. I know that we, like Petra said, really work closely with our community partners, and that's really been helpful, and also just listening to what the community needs and what they're asking us for. So Angie, I'll hand it over to her.
Thank you, Alicia, and hello, everyone. So there is a lot of overlap in what my colleagues have already spoken about, and I am going to, in regards to the barriers and challenges, I will be talking on the Asian and Pacific Islander community. So setting expectations for quality aside, even the most basic access to care is severely affected when the hospital or medical professional who is supposed to advocate for your well-being doesn't speak your language and lacks understanding of your needs and values on a meaningful level. The ability to advocate for yourself or a family member is stripped away when you aren't provided with the tools necessary to communicate your basic concerns to its entirety. Instead, you feel helpless as you rely on another individual who may or may not be taking the time to interpret the meaning behind your words properly. This leaves your wishes unexpressed and both you and the medical professional struggling to work through gaps in the information exchanged, impacting the ability to create a viable care plan for you, as well as limiting your access to the valuable medical information being provided. A majority of people can recall facing challenges navigating the complicated healthcare system, even with the privilege to effectively comprehend and communicate in English. Now imagine having to navigate a complex call menu or phone tree without knowing what button combinations will lead you to a representative that can understand you. This seemingly small barrier is only one out of an excess of roadblocks that are interwoven and end up easily deterring an exhausted individual or family from reaching out for help and receiving the care they need, be it for COVID-19 or a progressive disease like Alzheimer's. This lack of access also extends into everyday life, where programs created without you in mind do not provide you the same benefits as it would for someone from the intended community, limiting your ability to participate in them and further dictating restrictions on your access to local supports and resources. I can get through this myself. I don't want to bother others, and I don't want to be a burden. This sentence encompasses the feelings of many API older adults as they self-isolate at home, refraining from reaching out to family or friends within the community. This mindset also plays a factor in why many members of the API community of varying ages experience a delay in seeking out medical assistance, which translate to a delay in care. In addition to inconsistent reporting, this may explain why the API community does not have an abundance of reliable data to accurately showcase the devastation caused by COVID-19, as the impact within this community remains not well understood. As it relates to caregiving, this mentality is also why API care partners of people living with dementia are often isolated and experience resistance or reluctance when considering the use of outside services. When talking about COVID-19, it is impossible to ignore the sharp rise of anti-Asian hate, racism, and xenophobia experienced and witnessed by members of the API community, as well as those outside of this community. I've recognized expressions of anger, helplessness, fear, and anxiety as unique stories stemming from private experiences of discrimination are shared with me. As an Asian American myself, I have been holding my breath also, anticipating when my own brush with COVID-19 targeted hate may occur. My mind often races with the different situations that I could potentially find myself in and struggle with how I would respond, should respond. I find myself very aware of my surroundings and cope through the fear and anxieties by focusing on what is in my control and recognizing my own limitations. Sometimes this does not work, and I find myself much like the older adults I mentioned earlier, feeling helpless and holding on to a very tangible fear. COVID-19 compounds many significant issues that affects all members of the API community at different levels and with noticeable imbalances in severity. I only mentioned a few. I must emphasize that I am unable to speak for any member of this culturally and linguistically diverse community other than myself. My role at Alzheimer's Los Angeles, as it relates to Alzheimer's disease, is to help connect members of this community to one another, to find their individual voices and feel empowered enough to address inherited stigmas, inherent feelings of shame, and to one day engage in self-advocacy. One of my favorite quotes by author Tara Reid emphasizes that while we are unable to change the outcome of Alzheimer's or another type of dementia, with the right support, however, we can change the journey itself. And so, I implore you to take time today and forward to think about how you can promote local awareness for the disparities experienced within the API community, to help create bridges that promote actions addressing barriers to access, to begin conversations which lead into discussions that will help others take notice of this often statistically invisible and overwhelmingly overlooked community. Let's be part of the support that helps change how people in the API community are seen and heard. Thank you.
Thank you so much, Angie, for sharing that. And thank you again to Jennifer, Alicia, and Petra. If anyone in the audience has any questions, please feel free to use the chat feature and we'll share those questions with the audience. So I think you all mentioned such important points and topics of discussion, and I was writing notes as you all were speaking. But it seems that, you know, for families and different communities who are already living either with someone with Alzheimer's or another type of dementia already had existing challenges. With COVID-19, I mean, it's only made matters worse. Jennifer, I know you mentioned this very good imagery of like the magnifying glass, and now everything is kind of compounded. But you also mentioned, Jennifer, some of the systems of care that we're working with. So I was wondering if you can talk a little bit more on a statewide initiative or on a national level, what is being done in the healthcare system, and again, on a local level, what is being done in light of COVID-19.
One of my favorite topics to talk about. So Alzheimer's LA has been partnering with the state department of the California Department of Aging and California Department of Healthcare Services to look at ways that we can improve the system of care for people who are duly eligible for Medi-Cal and for Medicare. So people who generally are over 65 and who are lower income, people that are really vulnerable. And so we've partnered with other Alzheimer's organizations throughout the state and with health plans that are providing care for people who are duly eligible, and looking at ways that they can make their system of care more, like I said before, dementia capable, more robust, more responsive to the needs of families, to do a better job recognizing the disease, to embedding tools into their system of care, validated tools into their system of care to help identify people who have the disease, to help them get a diagnosis, as well as tools to identify caregivers, assess them for their needs, and to create linkages with community-based organizations that can be supportive. And so our work has focused on the state of California, but we've had such promising practices in the state of California that other states have replicated our model here from California, which is really exciting. And we've also worked a lot on the federal level with the Centers for Medicare and Medicaid Services to issue dementia informational bulletins to health plans in the state, to help them be accountable and to look at their systems of care and where they can improve. So it's really exciting work because we do it on a local level with health plans that are literally in our backyard here in Los Angeles and also in the Inland Empire. But through partnerships, we've reached health plans in the state of California and have had national impact as well. And we've actually been asked to speak internationally about this work too, which is really exciting. So.
Great, thank you, Jennifer. And just as a follow-up, it looks like we have a question from Monica. So Monica, if you're okay, I can read that question out loud. Monica says, thank you for discussing the cultural inequities regarding COVID-19 and people with dementia. It is important to have a discussion about this. A big problem with the medical silos that exist is lack of AD education in terms of diagnosis. What is Alzheimer's LA doing to reach MDs locally, especially in ethnically diverse communities? Jennifer, if you want to take a stab at that, or any one of my other colleagues.
Yeah, it is a huge issue. The silos make it no better, and there's lack of education around diagnosis. I think some providers feel a lack of what I call self-efficacy, kind of this idea, well, if I do a diagnosis, then what? There's no cure, there's no treatment. What utility is there going to be? You know, we've heard anecdotally providers who also talk about, you know, but if I diagnose, then I have to report to Department of Motor Vehicles, and that opens another Pandora's box. So, you know, what we've been trying to do through our work with people who are dually eligible is work with the systems of care at the health plan level. And this gets really complicated. I don't want to get too in the weeds for people, but we've been working essentially with the insurance companies who then delegate the care down. And so we've been trying to embed at the health plan level validated screening tools that care managers can use to do a cognitive screen. And then we've been working with the health plans to have a system in place so that they can communicate those results with the providers, so with the doctors or a nurse practitioner, so that a diagnostic workup can be made. And what we've been trying to do is bake these tools into their IT systems and to develop workflow processes so that they don't just exist in the universe, but they're actually used and baked into the system of care. How you bridge that with the ethnic diverse communities, you know, it's looking at tools that are validated in multiple languages. It's education around how to hopefully bridge gaps in access to care, but these are really significant issues. And so we try to kind of work on various levels, both at the provider level, but also at the community level, to raise awareness, minimize stigma, to advocate and encourage people to have these conversations with their doctors as well. It doesn't just have to be top down, but also having families feel confident to have some of these conversations also. But this is really challenging, and there's other really wonderful models as well, statewide, locally also.
Great, thank you so much, Jennifer. A question for Petra. I know you mentioned the Dementia Network, specifically in the South Central community. Can you speak a little bit more about how we work in collaboration or as a partnership and how that's made an impact in the African American community?
I just want to add a little bit of something in regards to what Jennifer was sharing.
Yes.
And it does have to do with the Dementia Care Network. One of the things that we do is always talk about, and I mentioned it earlier, who's not at the table. And we recognized some time ago that there are some African American physicians that are critical to the work that we do. And so we started by simply saying, who is aware of a physician who is community minded and is willing to come to our meetings and be able to share what they're seeing and what their knowledge around the disease is, and be a part of what our work and what we do, because they are critical to the work. And so that was a broad statement, but all the members heard it. And then several decided that, oh, I know someone, or I asked around and somebody. And so that way we got connected to about 5 physicians who are people that I email often to share different things and to ask questions and share the services that we provide, so that they in turn can share with their patients. So the Dementia Care Network is a critical part of our work here at Alzheimer's Los Angeles. As I mentioned, it's established in 1997, I believe, at a really, at a time where the focus was definitely creating materials for a specific group that was culturally sensitive. It matters. They identify certain things that are challenges in the community, and one of the challenges is messaging. In the issues of health, messaging is so critical to how people react and how people perceive, and whether or not they accept that what the message is something that's affecting them. And so in the issue of HIV, as an example, for many African American families, communities saw the ads and information being sent out, and they were not present in the information. And so not seeing somebody that looks like you as it relates to advertising and messaging definitely has an effect. And so for a long time, just completely ignored it. Even currently with COVID-19 and the earlier messaging, kind of dismissed it as it's not actually something that's affecting our community, so we don't really have to consider it. These areas are constantly brought up in our Dementia Care Network. Everyone is in tune with the community, whether they're members of various churches, and they see things and they hear things. So their voice is critical to our work. And as an active listener, I need to hear what they're saying and be able to use that as a leverage to do our work in a more meaningful way. And so that's the Dementia Care Network has been amazing before COVID-19, and even now with COVID-19, we continue to meet and look to assist each other as much as possible. In the previous year, one of the things that we asked again, who's not at the table, and for the entire year of 2019, everybody invited somebody new. And not that they have become members, but someone from Los Angeles County who has specific information for South Central Los Angeles or particular areas that's critical to our work. They came and visited and dropped by and delivered information. And so we also had owners of assisted living facilities who are in very strategic areas of South Los Angeles and Ladera and other parts who came to visit and shared about their work and got familiar with us. So the members always reach out to potential members, because we realize that people always know people. They always know somebody that may be critical to our work. So for that reason, the Dementia Care Network is absolutely invaluable.
Great, thank you so much, Petra. And we have a couple of questions. The first one is Angie or Alicia, or both of you. If you talked about some of the different virtual groups and services that we provide, can you talk a little bit more specifically for the API or Latino community about what those resources are, either if they're in a different language or culturally appropriate? If you could talk a little bit more about the services or programs that Alzheimer's LA is currently providing.
So I can talk a little bit on the Chinese community specifically, because I am Chinese, or Taiwanese Chinese. So I wanted to mention a little bit and to elaborate a little bit more on the point that Petra had mentioned, how messaging matters. And that is just as true for the API community. I also mentioned, as I was speaking earlier, that even the term API encompasses such diversity in this large community that it doesn't always, something that works in the Chinese community does not necessarily translate over for the Korean community, Japanese community, and so on and so forth. And so really taking the time to understand each community is very important. We can't just create a program or service and expect people to join in when they don't have the base knowledge of what is Alzheimer's or what is dementia, or even just having to combat that stigma against reaching out to get help, like a little bit like what Alicia said in the Latino community. So I would say so far what we've really done is to make sure working with native speakers who are culturally and linguistically capable of understanding their communities, to come up with fact sheets and information, just for the very beginning, at the start, just so people of this community, say in Chinese, can get a better grasp on the situation. So they know what signs to look out for. They know when to reach out to, hopefully, a doctor that can help advocate for them. So it's such an interwoven, just a plethora of challenges that the API community must face. And what I do normally, it's again, connect with community partners that serve the individual communities that, say in the Japanese community, I have partnerships in the Korean community and so on and so forth. And so really, I would say that we look to the community to tell us what it is that they need, and don't expect a huge change when something doesn't work out. It's a little bit like trial and error, making sure that education and opportunities for access are in place. And so that might be creating a Chinese support group that we don't call it a support group. We call it a gathering where you meet with friends that are also, or meet with other people that are also caring for someone who might be experiencing challenges with their memory. And we make dumplings or, you know, anything else, and just make it into an appropriately safe space where people are coming to talk about any emotional challenges that they might be experiencing, as well as just anything that they want to talk about, and just building that bridge to connect people together.
So in terms of Latino services or services that we offer for our Spanish-speaking communities, in what I call normal times when we met in person, some of our Spanish-speaking support groups, you know, Latinos like to join around food, and so some of our support groups were really kind of potluck style, and people, you know, would kind of share around food, and that was a little bit easier for people to talk about feelings and challenges and things that were going on. Of course, that's a little harder to do in this virtual way, but we as an agency are still able to offer just Spanish-speaking programming virtually, and our agency has always had Spanish-speaking care counselors that people could call and work with on the phone, so that hasn't changed. And so you're able to work with a care counselor in Spanish to create a care plan to help provide disease education. We have our Spanish courses that are available, our Spanish support groups that are also available virtually, and we also have Spanish printed materials, but also something, you know, things that include our novela, which is our soap opera that was developed, Recuerdos Perdidos, that is something that we do provide to the community and have discussions around, and it's in a format that's very familiar to the Latino community. So those are some of the services that we at the Alzheimer's LA offer.
Great, thank you so much, Alicia. Another question that we have here in the chat box is, what specific supports are available to caregivers beyond the supports that ALZ Association provides? So Jennifer, if you just want to mention, or any one of my other colleagues, anything else I think that you know, makes our organization stand out, aside from providing that support to caregivers, generally, what else are we able to provide as an organization?
Yeah, so Alzheimer's Los Angeles, as mentioned, has social workers, care counselors who are available to work with families. We're offering virtual activity programs, which are fun, helping people stay engaged, especially while they may be home with someone who would otherwise be at an adult day center. So it's important to keep people engaged. We also have a number of plain language fact sheets that are available in multiple languages. And we've developed some fact sheets specifically on COVID-19 and dementia as well. So we really value having information that is written at lower literacy levels. It's available in multiple languages, but as mentioned, our care counselors, activity programs, virtual education classes, support groups, and then, of course, we also provide training virtually right now to providers as well and healthcare systems.
Great, thank you so much, Jennifer. And I'm going to share our screen right now so that you all have our contact information. Our website is here, as well as our social media handles. You know, it looks like we've come to the end of our time together. And one last question that we got from Jen was, how can someone support Alzheimer's Los Angeles, or how can a donor become involved? really, we welcome everyone to come to our website, alzheimersla.org. As Jennifer mentioned, we have a lot of really great resources, caregiver tip sheets in different languages. We're a nonprofit organization, and COVID-19 has really made an impact on everyone, but specifically our older and more vulnerable members of society. So I'm wearing my development hat right now and saying, we appreciate the monetary support, even just sharing resources with your friends and families and colleagues. So thank you, Jen, for asking that question. And thank you to all for joining our speaker series this afternoon. We encourage you to join us for the next session on Tuesday, July 28th. And the topic on that is going to be advocating for change. So we have Dr. Deborah Cherry and Barbara on our public policy team who are going to talk about statewide and national and how that's affecting the work that we do in our community. I'd also like to invite all of you, if you visit our website, to please join us for our virtual Walk for Alls. As you've known, we've had our walk for over 30 years, and this year we'll be doing it virtually in the safety of your own home. So please visit our website to learn more. Thank you so much to Jennifer, Petra, Alicia, Angie, and all of you guys who participated this afternoon. Please reach out to us if you have any questions, and we will be forwarding you a recording of our session this afternoon. Thank you so much for joining Alzheimer's Los Angeles. Have a great day.